I've been delivering the news to this community for 23 years.
We are 1 week into our Hero in You campaign, a month-long blood donation drive with a goal of filling every available blood donation appointment in November.
In 2011, my mother was diagnosed with 2 aggressive forms of blood cancer. It meant that she relied on routine blood transfusions for her survival. In the early days, she needed blood transfusions once a month, every 3 weeks. And then in the last months of her life, she was needing a blood transfusion weekly. They gave her an amazing quality of life. So my mom wasn't sitting in a hospital bed. She was living life to the fullest for those 5 years. I always wanted to give back. We talked about doing a weekend blood donation drive in her memory. And when I approached CTV Winnipeg with the idea, not only said they would be happy to do that, but they wanted to take it a step further and give me a platform to ask all of our viewers to donate in memory of my mom to bring in more donors. I've got lots of plans for years to come to continue to make it even bigger, bring in more donations. It's just the beginning.
My name's Dean Ferguson, and I'm a scientist, a senior scientist at the Ottawa Hospital. I've built my career in transfusion medicine research. Mainly my job is enabling and enhancing research all around me, nephrology, infectious disease, whatever it may be. And I really like helping others, hopefully open doors and new networks to my colleagues, especially younger and early career researchers. So a lot of my research is being focused on the blood product itself, but also alternatives that we can give to reduce and minimize blood loss and transfusion need. Over my career, I've dedicated myself to optimizing the blood products that we give patients and ensuring that they're safe and effective. Receiving the Lifetime Achievement Award from Canadian Blood Services is a real honor, and it just recognizes the work that you put in over the years. I'm really proud of that.
I finished my nursing training. I was at Queen Margaret College in Edinburgh, and I had worked on one of the children's wards during part of my training there. I applied to sick kids, and I got a job on the nephrology ward as a nurse. I loved bedside nursing. I mean, that was one of the things that made me want to come to Canada more than stay in the UK. You know, I found myself towards the end of my career realizing how much power a non-directed donor had, and knowing how many are out there waiting for a transplant, I decided to donate my kidney anonymously. And if you're interested in being a donor, it's a very doable thing. My life is very active and I'm very healthy. In this award, I guess I have the opportunity to talk more about the opportunity for people to be donors, and the fact that if people are considering it, there's some reassurance that you can still live a very normal, very healthy life.
When Canadian Blood Services approached us about placing This City Is in Our Blood mural on our building, it was the first time we'd done anything with our building in that way, but we thought it was a great opportunity to raise awareness about, the critical issue of blood donation.
CPSO has never done a partnership like that before, and when CBS initially approached us, it was an easy yes. But we wanted to make sure that we made as big of an impact as we could, and so we developed an internal blood drive for our staff so that we could not only bring awareness to the outside community, but also to our community here in the building. I know that it's easy to donate blood and that the need is always there. This blood drive was the exact motivation I needed to do it.
So my name is Theodore. I go by Ted Workington, and I'm a hematologist, blood specialist, who's been involved in patient care, research, education, and teaching for over 3 decades. Hematology, platelet disorders has been a lifelong fascination and really the focus of my career. I'm retired now, but that doesn't mean I'm off on the beach or anything. In fact, I think I'm spending about as many hours as I did pre-retirement, but I'm doing what I really want to do. So I'm doing research, writing papers, giving lectures, and so my career continues. Why do I do all this? Well, I like to figure things out. There's lots to figure out in medicine. That's the cool part of the job. I think I still have a role to play, and hopefully we'll make lots of important research and educational contributions in the years to come.
Noah was our 13-year-old son, and he was otherwise a perfectly healthy 13-year-old who loved playing sports, and one day suffered a stroke and eventually a brain bleed that took his life. We just kind of decided that after all the support that we had received from our community while we were going through those challenges, we decided to create the Noah Strong charity, and it's really been our way to recognize Noah for just being a well-loved and kind kid. Will be forever missed.
We talked about the organ donation, and so we made the decision to donate. Noah went ahead and donated 7 organs, so that piece is very important to us, to know that there's a little bit of him out there and that he's impacting other people in a different way. Strangers impacted their lives, and we don't even know to what extent. It's so impactful to know that it's about character and about who you are and kind of legacy you leave. It's not necessarily the things or necessarily all the accomplishments, but it's actually about how you made a difference and how you've impacted so many people.
Whether you're a researcher, a doctor, a nurse, an organization spreading the word, a blood donor, a stem cell donor, or you're like me and you're screaming it from the rooftops on your television newscast every night, everybody has a role to play in making a difference.